Okay, class. Now we are now in chapter 13. This is the eye and ocular adnexa auditory systems. Now we're going to be talking about the eye and ear. Now, this is the structure of your eye. Good diagram. Lets you see the different structures of your eye. Now, the highlights of this chapter that we want to go over is the eyeball is composed of a tough membrane called the sclera. This white outer skin of the eye is covered with a thin protective layer or conjunctiva. Light first enters the eye through the cornea. The cornea has 5 layers. Sometimes corneal defects will be managed by removing 1 or 2 of those layers rather than the full thickness cornea. The cornea meets the sclera at the ring called the limbus, also known as the sclerocorneal junction. Behind the cornea, the anterior segment of the eye, which is filled with a clear, salty fluid called the aqueous humor. Okay, that's hot topic. The eyeball. Now this is tell how lights reflect from the eyeball. The eyeball's shape reflects light and is focused and directed or refraction. Any reduction in the fluid within the eyeball will affect the eye's shape and refraction. For instance, if your eye is oblong or too oblong shaped, the patient will be nearsighted, and the term for nearsighted would be myopia. Now, if the patient is farsightedness or hyperopia, the eyeball is foreshortened and close-up vision is impaired. Okay, so if you are farsighted, you see better, then your close-up vision will be impaired. Okay, and that is called hyperopia. Okay, so it kind of sounds different, sounds backwards, but when it comes to nearsighted and farsightedness, but those are the terms for really being nearsighted and farsighted. The next thing that I want you to make sure that you remember is the introduction of the anatomy of the ear. Here's your structure of your ear. And in these 2 paragraphs right here, we have the context of the ear. The conduction refers to the transfer of sound waves. Sound waves take 2 paths in human beings. The first path that you have that sound waves travel are the waves can be captured by the pinna or the outer layer of the ear and travel by air along the auditory canal meatus to the tympanic membrane. Now the tympanic membrane vibrates the telegraph its message to the middle ear, where the malleus, so the little bone, picks up the vibration and transfers it to the incus and the stapes. These 3 tiny bones, the ossicles, carry the message to the oval window, a round window in the vestibule of the inner ear, into the chordae, where the perilymph fluid vibrates and creates nerve impulses to the cochlear nerve. Bone conduction is the second route while sound travels, and this is the secondary air conduction above. And the mastoid bones contain tiny air cells that also form a conduction path for sound. Okay, these are where sound travels in the ears. Okay, so make sure you go back over that, you all. Now, here's some terminologies, excuse me, that you will see throughout this section. Make sure you remember this different terminology. These are some different infections and neoplastic diseases that you have of your ear. You all make sure you go back and review this. Okay. Glaucoma, of course, you all know glaucoma coming from when you have diabetes. A lot of patients get glaucoma. Different types of infections. Terminology, acronyms, you all. I can't stress enough. Make sure these acronyms are somewhere where you can view them in your CPT book, because you will have these acronyms and you will not remember all of them. So make sure you write these acronyms down, what they stand for. Okay. Here's some more. CPT coding, another hot topic of the eye. Now, an eye is typically removed for 1 or 3 reasons. The first is the eye has a malignancy, the eye is blind and very painful, or the eye is blind and disfiguring. Now, there are 3 methods of removal that you can take to remove an eye. You can do an evisceration, an enucleation, or an exoneration. Okay, so make sure you all know these different methods for removing the eye. Okay, all right. And here are just some procedures that are done in this section. Again, in the medicine section, your HCPCS codes that you might use in this section. And remember, HCPCS is cut and dry. These are your modifiers. Now, these are modifiers, your bilateral, and then you have your E1, E2, E3, E4, and your LS, your LT, PL, RT, VP. Okay, make sure you know those modifiers. And here are some glossary terms that you will see as well in this section. Make sure you go back and read over these and make sure you get yourself up to par on some of these terms and definitions. And again, like in every section, we have that chapter review. Make sure you go back and take this, just like I can't scream it enough, y'all. The more you do it, the better you get at it. Okay. All right, and then number 10. All right, guys, we'll pick up with chapter 14 in just a minute.